from above and you palpate the tubercles. Why do you palpate the tubercles? Because if they are not even, closed kinematic chain. Did that have meaning to you? Not really? Well, then you come up here. This is sort of an aside to get there. Okay, I want you to stand up, face them, because they like to see your face. I want you to flex your knee without moving either of those joints.
How do you do that?
Well, the answer is
You can't.
you can't. Okay, give me your arm. I want you to flex your elbow without moving either my hand or there.
Okay.
Okay, flex your elbow some way. Or what would be another way? How about straightening your elbow? Okay? In a closed kinematic chain, if you move one joint, you must move at least one other joint. Now, I'm getting a little ahead of myself, but we're here. Have a seat. Now, we should never have a patient in this chair, should we? Because it won't lock. I want you to stand up. You stand up. Good. What muscles did he use to stand up? What? He used a hamstrings. The hamstrings flex the knee. It's going to throw him down. Huh? No, he didn't use triceps because he didn't put his hand on the armrest. I don't think so.
No, he didn't.
He didn't. My point is he used the quads, but they're too weak. What did he really use?
Psoas major, iliacus.
That would flex him. Pull him down. Come back down. Now, what is he in if he keeps his head straight up?
Oh, so he's going to extend.
He's in a functional, not... This is an engineering term, talking about building bridges. I forgot to bring my folding carpenter's old-style ruler. What did he use to stand up? He's forward. Come up. What straightened out? His hips straightened out by pulling the femur posteriorly, which did what? Extended his knee. The major muscle for sit to stand is gluteus maximus. Now sit down slowly. What muscle did he use to sit down? Gluteus maximus. Concentric? Eccentric. Okay, now here's my point. Thank you. If the SI joint, symphysis pubis, is out of position, what else must be true? Not so much the hips, because this is just a bone here. Something else in this structure has to be out of position. And it's probably going to be the SI joint. So I measure the position of the SI joint by palpating the symphysis pubis. I warn my patient, my hand's coming down. I get here. Once I get there, I don't go any further. Okay? So I want you to go ahead and look at these. Now, the sciatic nerve. It's not really something we're thinking about now, except I'm going to mention it when we get to one of the muscles. You find the greater trochanter, you find the posterior superior iliac spine, and coming down somewhere between there is the sciatic nerve. It's got to come like this. Two important things. It goes through a muscle called the piriformis. It goes under the piriformis, but in a certain percentage of patients, it goes through the piriformis, and if you have spasm in the piriformis, it's going to affect the sciatic nerve. It's going to hurt down here somewhere, and you can treat down there with ultrasound all you want to, and the pain won't even go away. You have to locate the pain. Okay, the other thing is if you're going to be weird and give injections, my wife used to give me an injection every 2 weeks. It was the highlight of 2 highlights in a month. Okay, just think it was fun. She had stabbed me in the rear. You have to not stab me in the sciatic nerve. I actually had a nurse come very close to my sciatic nerve one time. I decided I'd teach my wife how to do it. I say, do it here, and you're going to do it out here, laterally. Okay, I'll help anybody find these things, but see if you can locate them. You have a lab manual. I think it's got some pretty pictures in it or something. So I'll be happy to do it with you if you ask me.